Processed Meats and Cancer by Taylor Giroux. My research question states, do processed meats lead to an increased risk of cancer? I chose cancer because it is the second leading cause of death in the United States. Cancer starts when a cell mutates to become cancerous and begins to multiply uncontrollably and spread to surrounding tissues. The diagram on the right depicts a normal cell versus a cancerous cell. There are many factors other than processed meats that can contribute to an increased risk in the development of cancer, like low physical activity, diets low in fruits and veggies, and alcohol or tobacco use. When exploring what a processed meat is, it is a meat that has been preserved by smoking or salting, curing, or adding chemical preservatives. This could be cold cuts, hot dogs, bacon, or beef jerky. I chose to explore processed meats because they're an easy and quick go-to meal option, whether that's a breakfast sausage on an egg sandwich, a ham sandwich, or an Italian combo. They can also be seen as a healthier option because you can include things like lettuce, tomatoes, etc. with it. Processed meats are a big staple of lots of American experiences, like the 4th of July barbecues or even a baseball game. When exploring how processed meats and cancer connect, they are classified as a Group 1 carcinogen, meaning there is evidence that they cause cancer. This is due to the fact that processed meats contain nitrates, which are a chemical compound that is added into processed meats to act as a preservative. However, nitrates form N-nitro compounds during preparation or by digestion. However, these compounds are seen to be carcinogenic. It is overall recommended to limit your processed meat intake in order to decrease your consumption of nitrates, even sometimes avoiding labels that state nitrate-free or uncured because they can still include amounts of nitrates. Overall, the main two types of cancers that processed meats seem to impact are colon and stomach cancer. For the first experiment I read, the goal was to assess the association between red and processed meats with an increased risk of breast cancer, as well as if antioxidant supplementation can modulate that. The method of this experiment was a randomized double-blind placebo-controlled trial of 4,684 women who were given a low dose of antioxidants or a placebo for 8 years, while the association of processed meats and breast cancer was observed by the Cox regression model. When observing the results of this experiment, processed meat was directly associated with an increased risk of breast cancer, however, only in the placebo group, therefore also showing that antioxidants may have an impact on counteracting the carcinogenic effects. When looking at the second experiment I read, the goal was to compare diet with risk of colorectal cancer when observing the Cox regression model to estimate hazards for colorectal cancer by dietary facts. The method of this experiment was an observational cohort study where men and women aged 40 to 69 years old reported their diet on a food frequency questionnaire and were followed up with after about 5.7 years. The results of this experiment depicted that 2,609 colorectal cancer cases occurred, in which those who consumed 76 grams per day of processed and red meat compared to 21 grams per day had a 20% higher risk factor. Interestingly enough, this experiment was conducted in the UK, where consumption of 76 grams per day was an average level for a recommendation. However, that in fact showed an increased risk in colorectal cancer, therefore showing that a recommendation might not always be accurate. When observing the third experiment I looked at, the goal was to compare the colorectal cancer risk in mice based on a varying diet of processed meat consumption. The method for this experiment was an animal experimental study where for 8 weeks, mice were fed either nitrate-free pork, nitrate-free sausage, or nitrate-containing sausage. Then they were evaluated based on tumor, ACF, MDF, urine, and serum results. The results of this experiment show that the mice who were fed the nitrate-containing diet had 53% more gastrointestinal tumors as well as gut dysbiosis, proving that they had a greater cancer risk. These two pictures depict processed meat risk in the media. In the graph on the left, it is evident how as grams per day increases, so does the estimated risk ratio of cancer risk. The picture on the right depicts factors of what causes gastric cancer, and it is evident how processed meat is listed as one. therefore proving that it is medically evident that processed meat can lead to an increased risk of some cancers. In conclusion, the main two takeaways I got from this research was that processed meat consumption can lead to an increased risk of certain cancers, especially colon and stomach cancer, as well as the fact that antioxidants may help contradict the carcinogenic effects, which can be seen through Experiment 1. Thank you for watching.